On January the 23rd, in order to contain the COVID-19 epidemic, the city of Wuhan put its 9 million residents on lockdown, one of the most unprecedented moves in human history. On April the 8th, with most patients discharged from hospitals and almost zero new infections and a recovering city, Wuhan reopened. So what happened in the past 76 days of lockdown, and what measures were taken in Wuhan to make sure it recovered? Not only those who went to hospitals got tests. Actually, community workers knocked on every door of every household to make sure all confirmed patients went to hospitals, all suspected patients got their tests, all close contacts were quarantined, and all fever patients were monitored. That made sure no one was left out. By bringing them to hospitals and quarantine centers, that made sure the virus didn't spread further in families and communities. Many people have already heard that Wuhan built 2 brand new hospitals, Huoshenshan and Leishenshan, within 10 days to specifically treat severely ill COVID-19 patients. But that wasn't all. In February, Wuhan built 14 temporary hospitals by transforming public places like exhibition halls and sports center. More importantly, Wuhan assigned patients to different hospitals based on their conditions. Mildly ill patients will be sent to temporary hospitals rather than isolating them at homes. By doing that, mildly ill would have the chance to get treatment without overwhelming the medical system, and their conditions would not deteriorate. Wuhan also built hundreds of isolation centers. Patients discharged from hospitals will be sent to isolation centers for 2 more weeks of medical observations to make sure they had fully recovered and are no longer contagious. All close contacts will be sent to isolation centers as well before they are medically cleared. That includes testing fees, meals, medicines, medical treatment, accommodations for quarantine. Every expense related to COVID-19 was covered by the government. So patients of any economic levels could go to hospitals or isolation centers without worrying about incurring debt. That further helped to find out more patients. Just one day after lockdown, medics from nearly every Chinese provinces flocked to Hubei province to help. More than 40,000 medics came to aid the local doctors and save the local medical system, which was on the verge of collapsing. Now Wuhan is reopened, but it doesn't mean it's unprotected. Although the transportation is up and running, there's still a number of precautions being taken to avoid a second wave of the outbreak. For example, everyone in Wuhan still wears a mask if they have to go to public places. People need to get their temperature checked, hands and shoes disinfected before entering shopping malls and restaurants. Mobility is still limited in communities to deter mass gatherings. The war with COVID-19 is not over yet, but Wuhan is recovering and everybody's life is getting back to normal. For those people who are still living under lockdown and fighting this war, if Wuhan can recover, your city can too, as long as everybody is united and does their part containing the virus.